You want to finish what you started? You came to the right place. Them girls that you came with, you might have to part with. Depending on how this thing shakes. Waupaca, Kenosha, a kind of Milwaukee's in the house.
Hello, Northeast Wisconsin, and welcome to a special episode of the New Look podcast, where we're going to be taking a new look at trauma-informed care. This is an issue that's very close to my heart. I am excited to bring 4 conversations to you with some Wisconsinites who have not only helped me understand this issue, but have helped make Wisconsin a national leader in implementing trauma-informed care. All too often when we think of health or health care, we think of our physical health, and we don't consider the critical mental health components to our own well-being. And this is incredibly important because nationwide, millions of children, adults, and veterans have experienced at least one traumatic experience. Even one experience left untreated can create a lasting, toxic stress that negatively impacts our schools and our communities. And in children, we see this lead to developmental challenges. We see it lead to increased rates of incarceration and substance abuse. And in our veterans community, obviously, we've seen this manifest itself with the troubling rates of suicide in the veterans community, or just even problems reentering the workforce. And unfortunately, in the face of this pandemic, trauma is on the rise as people feel isolated. They don't have other avenues to seek help. So now more than ever, we need to ensure we're doing all we can to support our communities and prioritize our mental health. And thankfully, on this front, Wisconsin is very much ahead of the curve with the leadership of dedicated individuals across our state. Wisconsin has become the nation's first trauma-informed state. So today we're really going to dive deep into this issue and examine why we need to address trauma in people of all ages and what innovative practices Wisconsin is implementing at the state and local levels to help do just that. So first, we're going to kick things off with the former First Lady of Wisconsin, Tonette Walker, who was instrumental in this effort and really introduced me to this issue. All right. I am honored to be joined by a former First Lady of Wisconsin, Tonette Walker. And I have to say, the only reason I became aware of trauma-informed care and became interested in it is because of your work. And you're the one who first introduced me to it. And I'd just be curious, what's your own story with getting interested in trauma-informed care? Where does that all begin?
So I actually was approached by a dear friend of mine, Lori Lombach, who was running SET ministry in Milwaukee at the time. She introduced me to a doctor, a children's abuse doctor at Children's Hospital, Dr. Angela Karen. And they actually came to me and talked to me about trauma-informed care and ACEs, the study of ACEs. And that actual study took back in place, I think it was 1998, where there was a study being done. About 17,000 adults were being asked certain questions, and it really came out that these 10 things that happened to someone in their lifetime as a child really changed the outcome of their physical and emotional well-being later in life, physical well-being later in life. And so I mean, it just hit with me. It resonated with me. It made sense as to why people were, there were generations of things happening to people. There were ongoing conditions that people had that they really couldn't explain why. And so I was fortunate enough to get involved in that movement while I was First Lady. And we had 8 years of really introducing anyone and everyone who would listen about trauma-informed care. And we had made some real good strides in the movement, and we were happy about that.
Well, I've certainly seen that in my neck of the woods in Northeast Wisconsin. I mean, a lot of the forward-leaning counties, Waupaca County, Shawnee County, will cite your work when you were First Lady. Maybe talk a little bit about what you were able to, beyond raising awareness, some of the progress we made in Wisconsin in recent years.
So the thing that we actually decided to do, we started researching the movement. We had listening sessions all over the state. We wanted to know what the barriers were, and they were the same over and over and over again, no matter who we listened to, that there really need to be a culture change. So we actually decided about a year, maybe 2 years into what work that we were doing, that we were going to shift everything we were doing, and we were going to do really try to infuse a culture change into organizations and to government agencies. And that really was something that wasn't being done yet. There was a lot of movement around therapies and how to really kind of infuse it into the work that they were doing, but the systems weren't changing. So that's why we really made that shift. We tried some grassroots, bottom up kind of things. They were moving, but they weren't moving very fast. What we really realized that we had to come from the top up and the bottom up and the top down. And that's where we started working with organizations. And that was all the government agencies that really were in Madison at the time that my husband was working with. He infused that trauma-informed care in everything they did. And then we also started working with county agencies. And that's how from there, we moved on and we started going to other people that would listen, the federal government, that was you. We met with a lot of agencies there. That's kind of how we incorporated where we were at with the federal government.
And did you initially encounter some skepticism either at the state level or the federal level? I mean, I think for me, I'll confess, originally I was like, well, I don't understand this. And it was in some ways talking with or realizing that there was a connection between this and some of the stuff I was dealing with in the veterans community to suggest that trauma is, I mean, it's a real thing. It can alter your brain. And I think NYU is like mapping changes to veterans' brains dealing with PTSD. That was really kind of the light bulb moment for me. Did you encounter any difficulty in convincing some people on the ground initially?
Oh yeah, there was a lot of that. There were a lot of agencies that didn't want to do it, that didn't think it was worth. It wasn't going to change anything. And of course, everyone just thought it was kind of the flavor of the month kind of thing. Here's a new agency, here's a new request to an agency, and isn't that nice and isn't that sweet? But really, like yourself, after you start thinking about it and you start dealing and working with people who have toxic stress in their life or PTSD, like you talked about veterans, that you see that, wow, this is the light bulb moment. This is what's going to be a difference in the lives of these people, because these are things that can make a difference in someone's life because we can teach them resiliency. We can teach them that it's not what's wrong with me, it's what's happened to me, right? A student, a veteran, endless, you can pick anyone off the street that has ACEs. It's not that we can't do something about it, but we can do something about it. But we have to change the way we do the work that we do. And that's hard.
100%. And I think critical for me was understanding that this isn't a way of saying someone's a victim for all time. It's a way of empowering people. The understanding of an adverse childhood experience then allows that person to, and the people, whether it's a teacher or, a health worker or a mental health professional, to help that person grow stronger and overcome those adverse childhood experiences.
Exactly. And we see that when we bring this awareness to say a family that's in crisis, there seems to be some kind of hope, right? I'm not stuck where I'm at. I can change the trajectory of my life. I can have better outcomes later in life with health issues. If I realize that I'm not stuck here, I can make changes and I can move forward. And I think that's what the work was all about, was really just trying to make people realize that there is another way to do this kind of work. So And it's, to be honest with you, what we're talking about now is the money stream. Where does the money go? And you know that with government, you probably get it every single day. You're passing out money. And what we have to do is tie some restrictions to it. And there was some of that. And I can't remember exactly what you guys, Congress did do something right before I left about tying some money to, yes, you can have this money, but you have to use trauma-informed care principles.
Yeah.
And I don't know exactly what that was. You probably can find out what that was all about.
Yeah, and we also passed a resolution recognizing your work in Wisconsin, which was great to just get a lot of my colleagues aware of what's going on. And I think when it comes to the money side of things, I think part of the skepticism is okay, well, we're going to spend money on more programs, and this is the conservative skepticism, I'd say. But I sort of think about it as we spend so much money dealing with downstream problems, right? When people are adults and they haven't adjusted well to society, it's how do you get upstream of those problems? And that actually allows you to save money over time. And that's part of what I think is promising about this.
You really have to get at the root of the problem, right? You can't just give services at later in life because of what's happened here. We have to kind of get at it, because we can see that, mom was incarcerated, her mom was incarcerated, her grandmother was incarcerated, right? So what we got to do is stop that. We have to break that cycle. We have to get to the root of the problem, give the tools that they need to get to further themselves in life and to change the trajectory of where they're going. And so I think that was what inspired me every day, that when I was doing the work, that this is something that's going to take a long time, but it'll be well worth it. And it's like anything, it's slow going, but this movement is, it's, let's see, 20 some years, over 20 some years, we've been working at this, and there are pockets of good work all over Wisconsin, of course, but all over the country too.
Well, thanks to your work, Wisconsin became the first trauma-informed state. You established Fostering Futures, the statewide, initiative partnering with tribes and the state agencies and county governments. And, my hope is that continues. I know you're no longer First Lady, but I would imagine your commitment to this trauma-informed care effort continues. And kind of where do you hope the state goes with this in the future?
Well, I hear that good things are still happening in state government. I believe that they're now calling it resiliency, which makes so much sense, because we don't want to talk about trauma. No one wants to hear the word trauma. As soon as you hear it, you're like, no, I don't want to hear that. So I think they're calling it resiliency, which is good. I know that there is work still to be done in the state, but I know that the Marquette University put together a wonderful swim. They call it SWIM. And they're working with the city of Milwaukee on trauma-informed care. It's all good stuff. I know at the very end when we left, we had made an assessment tool that an organization could measure what they know about ACEs, and then a year later, measure their organization again to see how far they've come. And so that is available. I believe it's on Children's Hospital. They're on their website. You can pull that up and use that for your organization. We left that as a tool for anyone who was willing to do the work. They could use that. And so it is there. I think it's, for me, I kind of go in and out of it now. I'm kind of retired, but yet not. You can't, once you know about the study of ACEs, everything you do is related to that. Everyone you meet in the grocery store, everyone you meet at an event, you're being like, yeah, how many ACEs does he have? Oh, that's why he's crabby today, or that's why it's not working out for him today. It's hard not to fit that into your life, right? And
Absolutely.
You probably know that. So
Absolutely. Okay, so final question. There's only one right answer to this. Who's your favorite staffer that ever worked for your husband?
Oh, that is so bad.
I'm just kidding. Don't answer that. The right answer is Mike Gallagher, but
I love them all.
Okay.
I love them all. Now that you're a Congressman Gallagher, it really was you.
Oh, okay. Sure. I'll take that. Well, Mrs. Walker, thank you so much for not only taking some time to explain your work, but for starting this. And again, I meant what I said at the outset. I would not have even known about this were it not for you inviting me into the conversation. And so it's been an honor to work together on this. And just thank you for your leadership. I really appreciate it.
Yeah, and thank you for really, really stepping out there and crossing the aisle and working with Democrats and Republicans to further this cause and this movement, because it will be people like yourself that can really make the true change in the country. So thank you for that.
Great. Thank you. As I mentioned earlier, I am incredibly grateful to Tonette for bringing this important issue to my attention and for all her work to make Wisconsin the country's first trauma-informed state. She really led a culture change at the way we look at this issue. And Tonette mentioned that Children's Hospital in Wisconsin was really the group that got her motivated to do this. So it's only fitting that our next conversation we have about trauma-informed care is with Amy Herbst, the Vice President of Mental and Behavioral Health at Children's. Okay, continuing our new look at trauma-informed care, we are very lucky to be joined by Amy Herbst. Amy, how are you?
Good. Thanks for having me today. I appreciate it.
Well, we are honored. Amy is the Vice President of Child Wellbeing at Children's Hospital. She has dedicated her life to improving the lives of children, youth, and family. And so can't think of a better person to really help us put trauma-informed care, broader context and family and mental health and well-being, which certainly we've learned a lot about in the last few months as we've been stressed. So, Amy, just to get the conversation started, I mean, obviously this pandemic has had impacts on all of us, but your work at Children's, I think, provides a unique and specific view on the pandemic's impact on children. What are some of the general trends you and the hospital have seen with children, their mental health in the context of this pandemic?
Sure. So we do have about 2 million touch points with kids a year. So we spend a lot of time with a lot of kids all over the state of Wisconsin. And what we've seen in terms of the pandemic is kids really struggling with the isolation that they've been experiencing. So they ended the school year very abruptly, and now they've spent their entire summer in ways that they weren't expecting. So they're missing their friends, they're missing the activities that they were expecting for the summer. And some of our kids are also experiencing some stress in terms of what's going on in their families because their parents might be negatively impacted by the pandemic as well, not just their health, but maybe their employment too. So our kids are dealing with a lot, and social isolation is probably at the top of the list of what they're struggling with the most.
And so how has the hospital had to change some of what you're doing in order to respond to that crisis and the increase in social isolation?
We did have to change. We had to change at the drop of a dime. And really what you saw from us is we moved our mental health care from almost completely in-person care to almost completely telehealth. So we started providing video visits and audio visits to our kids and families who were established patients with us. And then over the last 5 months that it's been now, we've also started to see new patients through telehealth as well. That wasn't unique per se to the mental health piece of our business. We did that elsewhere also, but mental health has continued strong in terms of seeing kids through video and audio visits. We're starting to see some kids in person again, but a lot of our families are saying they like it and they want to continue with telehealth going forward.
How has being a trauma-informed provider affected your response to the crisis?
So at Children's, we're all really lucky in terms of Children's commitment to being trauma-informed. So several years ago, we started on our journey to have a trauma-informed culture. So not just to provide trauma-informed care, but to have a culture that's trauma-informed. And so that's allowed us to really pay close attention to the adverse childhood experiences our kids are experiencing in the midst of this pandemic. But also it's allowed us to support our staff in a way that helps them deal with some of the difficulties they're experiencing too, because it's not just our patients and families, it's also the staff that work at Children's that are dealing with this as well. So we really were well prepared in a situation that you couldn't necessarily prepare for in terms of our trauma-informed culture and the work that we've been doing for years to put that in place.
Really started seeing that investment you made pay off in the midst of this crisis.
It really is paying off because I think our staff just think a little bit differently about what does this mean to our kids. And, it is traumatizing to be so isolated. It is traumatizing to see your parents struggling in the midst of this pandemic. And that is, again, hard on our staff sometimes. So they have some tools that they can use individually or collectively with their team to support each other in terms of coping. So it goes from the kids and families we serve to our staff who are taking care of those kids and families as well.
So help me understand, I think part of the problem with this is, we've had to shut down, to slow the spread of the virus. But, as you allude to, home can be a traumatic place. It's not always a safe place for kids in Wisconsin. And more to the point, this idea that we're going to shut down, but through the magic of modern technology, we can, everyone's going to do school, distance, and, we're all going to be reading deep works of philosophy as opposed to binging Netflix. It's a bit, I don't know. I think that analysis breaks down when it collides with reality. What do you see the risks of, kids, spending this time growing more isolated and spending the time online in particular? I'm really worried about just this whole generation spending all day doing this. Heck, it's my generation, right? Like, we're addicted to it. As a new parent, I think constantly about shutting this off and not modeling that behavior for my daughter. So maybe talk about the intersection of the digital age and kids' mental health, if you will.
Sure. So it's a fine balance, right? That there's something to be said about technology and all the benefits that can come from that. We've seen it in terms of being able to provide mental health care on an ongoing basis through the use of technology. But also, technology can create and add to that isolation that is already existing. It also can create some difficulties for kids who are watching some of their friends, maybe having some more social interaction or playing with friends or hanging out with their friends when they can't themselves because their parents have made a different decision. So, it allows you to stay connected, but it also allows you to stay connected all of the time. And that isn't necessarily healthy. So balance, it's all about balance. We want parents to be able to talk to their kids about how they're feeling right now in the midst of this challenging time, and school's getting ready to start, and that's uncertain for some people. But also to say to their kids, let's take a break from your phone. Let's get outside. Let's ride our bikes. Let's play basketball in the backyard. Let's read a book, take a nap, whatever the case is. We want there to be some balance there. And a lot of our parents are telling us that's exactly how they're managing their kids' time. And while there have been some bumps in the road, it's been really pretty successful. We're lucky to be in summer right now. It's certainly helping the cause.
Yeah, imagine if it were dead of winter in Wisconsin, there would be less going outside. That's for sure. Well, I think it's a tough balance, right? Particularly if you have parents that, let's say, have to go to work, and don't have the resources to, hire childcare. How can you make sure your kids aren't spending their whole day online, that they're doing their homework distance? Do you, without getting into a really thorny issue, obviously we're debating this, how do we open schools responsibly? It's not an easy cut and dry issue. I tend to believe the benefits outweigh the costs, but I don't know, maybe from your perspective, how are you approaching that? There's got to be a mental health value of kids going back in person for school.
Well, there is a value in terms of their mental health. You're right. That reduces the isolation. There's no doubt. But for some families and kids, they're just very worried about going back to school, and it's producing a ton of anxiety for some kids. So we really see it as unique to each individual child and family, and believe that it's a decision each parent needs to make. We are lucky to have a lot of scientists and doctors at Children's that know what is best in terms of health for our kids and families. And so we've been looking to them. We've been, of course, very engaged with the American Academy of Pediatrics and working with them about what's best for kids and families. And we believe schools are trying to figure this out. They are trying to make their best decision for each individual child, but collectively, all of those kids, and of course, their teachers as well. And we're trying to do our part through any connections we have with kids and families, just to talk with them and process with them how are they feeling and help them make the decision that's best for their families. It's a tough time. It's a tough decision for people individually and collectively, but we think they're trying to do their best.
Yeah, I mean, that's certainly in talking with the school districts in my neck of the woods, it's a difficult problem, and a lot of our really forward-leaning superintendents are engaging the teachers, the parents, and the local community in a conversation about how do we figure this thing out. There's no perfect plan, no 100% solution, but I think particularly for younger kids, I think it's fair to say that there are severe limits to digital and distance learning, right? And that the benefits of socialization are huge, and so we have to find a way to safely get them back in person. At least that's my own view. Talk a little bit about, so Children's just launched the Shine Through campaign, which works to raise awareness of mental and behavioral health needs for Wisconsin's children. What is the campaign, and what are the partnerships it has created to help kids across our state?
Yeah, thank you for asking about that. The Shine Through campaign is exactly what you said. It's a mental health awareness campaign, and it's part of our $150 million commitment to improve the mental and behavioral health of kids in Wisconsin. So we have 3 areas that we are investing in everything that we do. So we want to detect mental health issues early. We want to increase access to mental health care. And then we want to raise awareness and reduce stigma. So over the next several years through the Shine Through campaign, you should see us showing up on social media. You should see us showing up in your communities and schools all across the state. And our interest is to get to a place where people see mental health as health, and simply nothing more than that. So the first thing we're doing as we kick off this campaign is Shine Through Pledge. And it's all on social media. And we're asking parents of school-aged kids to take this pledge. And all we're asking them to do is talk to their kids about how they're feeling. How are you feeling about the summer and how it's gone? How are you feeling about school starting again? Are you looking forward to it? Are you worried about it? And giving their kids an opportunity just to express their feelings. We hope that parents will post on social media using the hashtag #ShineThrough, and they'll encourage their family and friends to have those same conversations with their kids and spread it all across social media.
That's great. And when will that be kind of being rolled out? What's the timeline for that?
We're beginning to roll it out right now. So
great.
Over the next days and weeks, you'll start to see this showing up on your social media accounts, whatever it is that you use. You'll start seeing hashtag #ShineThrough.
Okay, so hashtag #ShineThrough. I'm like the least cool and least social media literate millennial in history, so I'm not. There'll be maybe 5 people at most that hear it on this, but I'll in my personal interactions, I'll promote #ShineThrough every day. It sounds like a great. Yeah. So kind of 2 final questions that are a bit different. How do we know? I mean, what are the best ways to measure success on this front, right? I mean, it strikes me that mental health is such a complex topic. I mean, it's probably easier to quantify physical health. We can measure rates of obesity among our children in Wisconsin, which are very troubling, by the way, and could in turn affect mental health. But how do we get a sense of whether Wisconsin is improving or things are getting worse for our kids?
So there are several good measures out there that we are paying attention to. One is the rate of hospitalization. So Wisconsin kids are hospitalized at a higher rate for mental health crisis care than elsewhere in the nation. We also are taking a look at the rates of suicide. Suicide is the second leading cause of death for our youth in the nation. And so we are paying very close attention to that because we have to do better in terms of how our kids are doing. And we would tell you that one of the most important measures as it relates to kids and their mental health is access. Are they getting access to mental health care? Not just any kind of care, but the care that they need and where they need it and when they need it. And so we are also taking a look at that measure, and we're going to do our part, and we're going to partner with others because it's going to take all of us, not just children's, to do better and to make improvements there. But those are just some examples. I would say access is the one we are paying close attention to. Kids need access to mental health care, and we are going to create more of that.
That's great. So if someone in Wisconsin, a parent or a teacher or whoever wants to learn more about your efforts specifically or trauma-informed care more broadly, what are some good resources? Where should they go? What's kind of the entry point for that conversation?
Sure. So again, you'll get back on your devices. I would say that's one of the
Shine through, hashtag shine through. That's one.
Hashtag shine through, hashtag shine through pledge. Those are both great ways to get access to information about mental health, kids' mental health. There's links that are available. There are some videos out there from some of our psychologists and providers that are there for parents to talk to them to say, here are some tools and resources for you, because parents are key, right? They are the most important people in a kid's life, and we want to give them everything they need to help their kids be healthy. So, I would say the easiest way is hashtag shine through pledge, and that'll get you started on your journey to accessing any of the information you need.
Fantastic. Well, Amy, thank you for not only taking some time to talk with us, but for your leadership in Wisconsin and for all that you and Children's does for kids in our state. I mean, that is our most precious resource statewide. So thank you for your leadership in this field, and hashtag shine through. So I'll ask my younger staffers what a hashtag is and how I can figure that out. So
they'll let you know. And we thank you too. We thank you for the work that you've done in terms of trauma-informed care and for having this podcast on mental health and trauma-informed care. It matters. You are a good partner in this space, and we appreciate it, and it's going to help the kids.
Well, that's very nice of you to say. Well, thank you so much, Amy, and look forward to seeing you in person some point soon.
Yeah, that would be great. Thanks.
All right. Thank you. While this pandemic has been extremely difficult for all of us, as Amy mentioned, it's been especially difficult for our children, and a call for hospitals and organizations across the state to alter the way they provide trauma-informed care. And one organization that has, in my opinion, gone above and beyond to not only help individuals in the pandemic, but provide resources for others to do so as well is SaintA in Milwaukee. We're joined next by their president and CEO, Ann Leinfelder Grove, to discuss ways that they're implementing trauma-informed care in the pandemic and the tools they've created to help others do so. Okay, I am very excited to have Ann Leinfelder Grove with us on the New Look podcast to talk about trauma-informed care. Ann has served at SaintA for close to 30 years in a number of senior leadership roles, including executive vice president, COO. She has championed the program implementation of SaintA's trauma-informed care model, and just done a ton of work on this issue in the greater Milwaukee community. And so, Anne, thank you so much for joining us.
Thank you very much. I'm delighted to be here with you.
So for our listeners, tell us, what is SaintA, and what is your mission, and how does trauma-informed care fit into that?
Sure. SaintA is a human service organization that's headquartered in Milwaukee. This year, we celebrate our 170th anniversary of service to the community. So although the way that we go about helping children and families and people is different in 2020 than it was in 1850 when we were founded, some of the very core principles of our mission remain the same. Helping people, stabilizing their situation, and creating for them the opportunity for healing from past difficulty and the opportunity to have hope for the future so that they can thrive. Our current mission is to facilitate equity, learning, healing, and wellness in order for people to thrive. And we're excited to do that. Trauma-informed care is a very big part of how we go about helping people. We've been engaged over the last 12 years in utilizing a trauma-informed framework that helps us make sense of people's story. You know, oftentimes people say a big aspect of trauma-informed care is this question, what has happened to you, right? And so we embrace that, looking at people's experiences and what brings them to our care, rather than judging them for any symptoms or circumstances that express their difficulty.
And can I ask, for you personally, Anne, what kind of led you to SaintA, and how did you get involved in this work to begin with?
Good question. So I joined SaintA, as you mentioned, 30 years ago. Initially, I was helping manage our community volunteer program as a part-time employee, a chance to give back to the community, a chance to engage with an organization that looked interesting and that I liked. I never would have imagined to stay this long. I have stayed this long because it's been interesting and purposeful, and to me, if I can say it humbly, really an important organization for creating success for Milwaukee. Our trauma-informed work has expanded our footprint to across the state of Wisconsin, and even nationally now, where we're doing training and consultation in trauma-informed care around the country.
And early on, SaintA created a number or a trauma-informed action plan to help staffs, clients, and the community reduce the risk of coronavirus. Could you tell us a little bit more about that plan and how you were able to implement it during the pandemic?
Well, our just like many organizations and really all of us, that overnight switch from what we were doing to what we had to do in order to protect and provide safety and support, happened in the blink of an eye. In March, we knew we had to move from a traditional service delivery of face-to-face home visits, face-to-face mental health therapy, to all of that happening virtually via smartphones, via laptops, virtual visits for child welfare families to make sure kids were safe, and a telehealth platform for mental health in our clinic to make sure that the people who needed us could connect regularly. On any given week, we're serving 5,000 people, and that means that weekly we have thousands of client contacts, and they're important because even before COVID, these are engagement and relational connections that help people heal. Now add the additional isolation and anxiety that COVID creates, not to mention some of the other pressures with employment, housing, healthcare. It was the real deal. And I'm really proud of our staff who've done everything they can to make this work, themselves working remotely from home, right? And many of them with their own children to manage their schooling, maybe elderly parents and family members to care for. it was very important that we stood up our new business model quickly. We like to say that we advanced 10 years in 10 days time because we had to. And we continue most of that work being remotely today, although we're gradually working back to face-to-face visits and appointments with the people in our care.
And SaintA's has identified what you refer to as the seven essential ingredients to trauma-informed care. Can you give our listeners more information on these ingredients and how people can implement them perhaps during the pandemic?
Sure. So 7 essential ingredients is the model that we created now in 2008 as a way to teach our staff about the prevalence and impact of trauma, particularly childhood adversity. And the ingredients are all based in science. They tell us what the science has taught us about the impact of trauma or the potential impact of trauma. And it guides us through a series of steps to help bring about stability and healing. Simply stated, the ingredients are prevalence. So recognizing that across society, there is a likelihood of traumatic exposure, bad things happening to people, and really understanding from a data-driven perspective how prevalent trauma exposure is. Then the second ingredient is impact, what the potential impact of trauma is on somebody's life. One of the seminal research projects is the ACE study, which I know you're familiar with, Adverse Childhood Experiences, that teaches us that when adversity occurs in childhood, there is the potential for lifelong impact, not only in mental and behavioral health, but also physical health. And people with a higher number of ACEs who don't also experience healing are also at greater risk of a reduced lifespan of up to 20 years shorter life expectancy. So impact of adversity is a big deal. The third ingredient is perspective shift. This is that what has happened question. Instead of looking at somebody and judging them for their current circumstance, a curiosity about their life story, an interest into what might have brought them to this place in time where they need the additional care and support. So perspective shift is a big one. Actually, I'm a fan of all 7, so I'm afraid I might say that every time as I reflect on what I said. The other next big one is regulation. All of us do well when we are at a place of calm, are at a place of attention and focus. Regulation doesn't mean like something in the legal realm, a law. Regulation means that you're regulated and able to pay attention and cope. Every human being regulates in different ways. Maybe you're a runner, or maybe you love to read, or maybe you enjoy athletics as a way to regulate. Some people like to knit. Other people appreciate the creative arts. Everyone has the opportunity to find what works for them with regulation. Our job is to help people find what it is that works for them. I had a kid in our care who loved to bounce on a pogo stick. And so we got real smart about that and gave him a pogo stick in his classroom. And there was a pogo stick in my office so that when he left the classroom, because he was dysregulated, he could come and jump on the pogo stick there and near me, and then return back to the classroom to continue his studies. So that's an important one, regulation. Relationship is the next ingredient. Healing occurs in relationship, and programs don't heal people. Engagement with other people does. That's very fundamental to our belief, based very much on our relationship with Dr. Bruce Perry, who's one of the world's preeminent experts on childhood adversity and healing. And his model, the neurosequential model, teaches us a lot about how important relationship is in order to help people heal.
When you
Go ahead, please.
Go ahead.
reason to be is the sixth ingredient, and that is your purpose. What excites you? What gets you out of bed each morning? What gives you that focus and that optimism that help guides you on a daily basis? And the final one is caregiver capacity. No one can help someone else if they themselves aren't in a good space, right? So for us, caregiver might mean a parent, a grandparent, could be a foster parent for us in our work, but it also means all of the staff at SaintA have to be themselves as caregivers, taking care of themselves in order to help others.
When you first started to implement some trauma-informed care best practices or talk about the 7 essential questions, did you confront any skepticism either in the community or your colleagues? And talk a little bit maybe about that and how you overcame that. I think one of the things that tends to, at least, it can turn some people off is, well, you want to make sure you're giving people agency, right? And for me, the light bulb was thinking about trauma-informed care as a way for people to get that agency, not just sort of and get over trauma. So maybe talk a little bit about that, sort of the early speed bumps in convincing people to see the light here.
Some of the early speed bumps were the perspective that this sounded like it was a little too soft, that people had to, strap on their boots and move through their own healing, and that everyone who struggled with that perspective had a story about their own grit or their own tenacity or the bad things that happened to them, and look at how great they were now. But when you unpack those kinds of questions with someone, inevitably they're able to identify that important person in their life who was a part of that success. Maybe again, it was a parent or caregiver. Oftentimes it's a teacher or a coach, somebody who really helped someone succeed. So that whole, toughen up, and it's about, finding your own way, was, a barrier for some. Transitioning to that whole relevance of somebody's life story as being part of what we would unpack in order to help them. The world of care is in a medical model which limits the amount of time that a therapist or a clinician has to help someone. Finding out what happened to you takes some time. And then once you understand what happened, building a plan for success also takes time. So we had very enthusiastic physicians tell us, this is perfect, I love it, but I don't know that I have the time to implement it within the course of my responsibilities. And so now we see healthcare systems embracing this, understanding the social determinants of health are in fact determinants of health, and giving a little more grace and being a little more creative to allow for healthcare practitioners to have these conversations with the people in their care.
Yeah, I think one of the biggest outcomes of the pandemic will be or should be an enhanced discussion on social determinants of health. I mean, we have these knockdown, drag out political fights about health insurance and billing, which are important to be sure, but they're all downstream of your actual health and the health of your community. And for me, kind of the light bulb was I had spent so much time in my life in the military thinking about physical health from a what do you put into your body and what do you do with your body perspective, and not thinking about, well, what you put into your brain and what you consume mentally is as, if not more important. And then seeing the impact of trauma on the veterans community and the skyrocketing rates of suicide, that for me was a big light bulb moment. So I hope we kind of can elevate that discussion on social determinants.
I think that is essential. As we navigate our, as you pointed out, very polarized conversation, trauma-informed care is an appreciation that traumatic things affect everyone. This isn't just a particular political party. It isn't a particular socioeconomic group. It is not a particular group of people based on the color of their skin. Everyone has the risk to experience adversity, and therefore we, as people helping guide folks, have the opportunity to help shape that narrative and try to build bridges, such as you've done with the Congressional Caucus for Trauma-Informed Care. Super important. You know, no matter what we agree or disagree about, there are some things we should agree about, right? And that's what I read in the spirit of your efforts to bring awareness to Congress and to federal programs and policies. Really an opportunity right now in our history.
Well, SaintA's, I mean, obviously is a leader in that, and you have a number of resources available on trauma-informed care, including what you call the compassion curve. Where can someone go to get more info on the work you're doing at SaintA?
We have as a part of our website, we have a trauma-informed care tab, and our website is very simple, sainta.org, SAINTA.org. And within that trauma-informed page, there are a number of training opportunities that are available. Some of them are free of charge. You mentioned the compassion curve, and that's really been our translation of the 7 essential ingredients applied in COVID times. When you think about early on in the pandemic, we heard about flattening the curve. That was just, very steady message to all of us. It continues to be today. But in March, we said, well, in order to flatten the curve and to be successful at that, we have to make sure that people have the wherewithal and the ability, and as you said, the agency to do good things in these times. So we created Compassion Curve as a very short training curriculum that helps explain some of the core research findings in trauma-informed care for the layman. You don't have to be a clinician or an expert, just somebody who wants to help others. And we're now hosting monthly Compassion Curve virtual gatherings for people who are interested to talk about what they know and questions they might have.
That's great. Well, Ann, thank you for taking some time to explain the great work you're doing, that SaintA is doing, and I encourage everyone to look at your website. And it's really encouraging just to see just such innovation happening right here in Wisconsin. So thank you for that, and thank you for sharing your knowledge with us. Really appreciate it.
Thank you very much. I appreciate the opportunity. Take care.
Take it easy. That was a really illuminating conversation and goes to show that there are tremendous resources out there for any business organization or individual to use to help make their community more trauma-informed. And in fact, right here in Northeast Wisconsin, we're seeing tremendous leadership on this issue from people like Peg Burrington in Waupaca. She used her position as the library director to come up with a number of projects to help raise awareness of and address trauma in her community and make Waupaca more trauma-informed. And we'll hear from her on her work and tips on this topic next. All right. We are here with another episode of The New Look, where we're taking a new look at trauma-informed care. And we're very lucky to be joined by Peg Burrington. Peg, thank you so much for taking some time.
Oh, you're welcome, Mike. It's my pleasure.
Peg is the library director at the Waupaca Area Public Library. She's been doing some really cool work at the localized level, integrating and building a trauma-informed care community in Waupaca. And it is just, it's really inspiring. And so I wanted to bring Peg on to talk about the work she's been doing, whether it's the art project, the Drawn Together by Kindness, as well as some of the other things. So maybe Peg, as a starting point, Waupaca really has been a leader in incorporating trauma-informed practices for years now. How did you first get introduced to the initiative and making a community more trauma-informed?
Well, I have to say that we've been talking about the ACEs, those things that happen to a child as they're growing up for a long time, over 10 years. But it was only recently that I realized that those are also linked to a way of responding to people who've been in trauma, and that whole idea of being trauma sensitive. So that allows us then to approach someone with the idea of, rather than what is wrong with this person, what has happened to this person, and what is it that I have that I can help them with?
And what was your what was there a light bulb moment for you? I mean, how did you personally first get introduced to ACEs and trauma-informed care and that stuff?
Well, I was a teen librarian before I was library director. So with working with teens, you recognize that they've been through things in their lives and that they're looking for that safe place. And the library definitely can be that safe place. But more recently, I came in contact with many of the people who are working for the county, Waupaca County, and they have a trauma-informed care model in place to work with the families that are struggling. And so it was through that contact that I started thinking about how can we make this not just for those people who are struggling that are a part of the care that's provided by the county, but everyone in our community, because everybody is searching for that place to belong. And that's what we want to be, is a place where everybody feels comfortable and they know that the reception they receive will be one of compassion and one where they are going to be welcome.
Yeah, the library is really a focal point for the community, right? You attract people from all over the community. I guess what would be your message to the skeptics about why, who may not understand why it's important that the community in Waupaca be trauma informed?
Well, I think especially now we can recognize that everyone has trauma in their lives, that they've experienced trauma, and especially the people in the gay community, the BIPOC community, all of these people have experienced trauma, and we can turn on the news and see it's happening, and it's happening in everybody's everyday lives. And even the idea of having to wear a mask for someone who has experienced trauma may be even more traumatic. So I think we have to approach everyone with compassion and give them the services that they need, even if they don't feel comfortable with the rule of wearing a mask. So I think for us, it's really about making sure that our first question is, how can I help?
Yeah.
What can I deal with?
Absolutely. So maybe talk a little bit, Peg, about the projects that you had planned related to trauma-informed care in the community. Were they kind of disrupted by the coronavirus pandemic, and how have you had to adapt those plans?
Well, the library themselves hosted a Brene Brown series, which was really a stepping off point for people to realize the principles that Brene Brown has, including empathy. So making sure that you're true to yourself and then allowing others to be true to themselves. So that was the first piece. And then we started something called Life Class. And Life Class is a group of people who get together, who want to create community by talking, so community through conversation, and learning about subjects that maybe will help us begin to be more open to others and to our own feelings as well. But one of the things that came about all about the same time is we were looking for a model of a community that was a trauma-informed community. And we found Tarpon Springs in Florida, and they are a very similar community to ours. They have a vacation set of people who come in. Theirs come in the winter, ours come in the summer, and they have a poverty level that's recognized. 45% of our children are on free or reduced lunch, and just not having enough to eat can be trauma for sure. So we found a similarity there, and we talked to Robin Sanger, who was the deputy mayor and founded Peace for Tarpon, which is their trauma-informed care initiative. And one of the things that they were trying to do was to make a visual statement about kindness in their community, and they had created flags which were then flown in their downtown. So we worked with a group of people, wonderful people from the arts community that came together, and we sewed we created a teardrop shaped flag in a group as an exercise, and we put markers and all of our messages about kindness and thinking about kindness and sending those kind thoughts into the universe. And then the group themselves sewed them together. So the teardrops became hearts.
Oh,
and
wow.
were displayed on our square for a week. Normally they would have been during Arts on the Square. That had been canceled. So we had all of these flags that had already been prepared. We didn't have perhaps the greatest number because the pandemic interrupted the creation, but we had enough to make an impact, and they were gorgeous. Just looking at them was uplifting.
Well, that's great. I imagine you've gotten a great response from the community with these projects. Where do you think? I mean, let's hope we kind of continue to claw our way out of this pandemic and we don't get even more divided than we already are. Where do you see kind of as the next steps in the community there in Waupaca? How can we build upon the success you've already had with trauma-informed care?
Well, I think one of our next steps is to make those connections within our community so that people feel they belong. And we've kind of adopted "You Belong in Waupaca," and there's a mural downtown that says "You Belong in Waupaca."
Oh, that's great.
Next point is, while the library has been trained in trauma sensitivity, and the school district, certain portions of that have been trained, and the county's completely on board, there's a whole set of businesses and organizations within our community that don't know what trauma-informed care is and are not aware of those principles that we can apply when we interact with people, that trauma sensitivity. So what we want to do is really create a way for the training, the trauma-informed care training, to be put out in the community for those organizations or businesses that want to learn more about it and want to become that perfect, welcoming community that we all envision.
That's great. I'm sort of curious. So what is the state of play with the library in Waupaca now? Are you back up and running totally? Is it, if I was going to come, there, what would be the rules and how are you providing just general services to the community right now?
Well, we were sent home like a lot of workers in March, and we came back in April to provide curbside services. Continue to provide those curbside services for people who don't feel comfortable entering the building. If they want to enter the building, we have computers available that they can use for an hour. We have study rooms that can be used for up to 2 hours. And browsers can come in with a mask. Everyone enters with a mask. We have hand sanitizer that they're asked to use. And we ask that anything they touch get put in a basket. The DPI, the Department of Public Instruction's recommendations for quarantining mean that things that are handled actually wait for 4 days before they can then be handled by library staff, who have a very strict regimen of hand washing, mask wearing, and sanitizing hands on a regular basis. And so all of those things wait a while. But people are thrilled to be able to come back in. We show our friendly faces from the nose up. And if people can't wear a mask, we make those accommodations. We ask that they stay in their car or direct us from the lobby, and we will get the things that they need or want from the library. So we remember we're still being trauma sensitive.
Sure.
At the time, we're trying to provide the service that we can at this point in a way that's safe for everyone.
Absolutely. Have you seen an uptick? I may be going a little off the trauma-informed care script, but I love libraries. I'm fascinated by this. Has there been an uptick in sort of digital services? I don't know if you guys offer like a Libby type app as people, maybe there's been a downturn in physical books. And let me disclose my bias. I hate Kindle books and digital books. I love to have the physical book in my hand. I like to mark it up. But I've been a reluctant convert at times. And there's some things that you can get via Libby that are pretty cool too.
So one of the things that happened in March is that we could not provide physical materials except through our little free libraries in our community. So we stocked our little free libraries with those books that we hoped people would come and pick up. And then we also encouraged using our digital libraries. That is available for every public libraries that's in the state of Wisconsin. It's a great resource for us. And most recently, one of the things they've done that I think really uses those principles of sensitivity is that they've given there are sets of books, anti-racist books, that are available all the time. So even if you can't get a physical copy from your library, you can check it out from Libby, download it to your device, and read or listen. So our digital library is very strong. We have seen definitely an uptick in the number of people who've been using our digital library, but we've also seen people who have said, oh, thank you so much for opening. I really just need a physical book.
Nothing can take the place of having a great physical book that grabs you in your hands. So I appreciate that. Well, I think one of the things that's really hard for us to figure out right now is, we've had to shut down and change our way of life to slow the spread of the disease. But we also have to realize that, for a lot of kids in Wisconsin, home is not always a safe place, right? And, we talk about ACEs and things like that. And so, whether it's a school or a library, there are kids that just need a place outside the home to go to. Maybe just talk a little bit more about some of the just the services you offer to kids in Waupaca and things like, and how important those services are.
Well, I can't stress enough the importance of learning outside of school. And unfortunately, because children do have a tendency to touch everything, we do have a limit, one parent per child, unless the child's over 10. So that's the only way we can really guarantee, or we can't guarantee, but we can keep it as safe as we possibly can. But we've done some other things like putting puzzles on the sidewalk for kids to solve, and recognizing that families are really suffering right now, and providing that curbside service. Our children's department has what they call book packs, and you call them up or email and say, these are the ages of my children, please prepare something that I can pick up by curbside.
Oh, amazing.
A pack of books. And of course, when you have a librarian who knows the collection, getting 15 to 30 books at your home for your kids.
Wow.
Better than that. Think of you as a new parent. You probably aren't real familiar with literature right now. I know my son-in-law are thrilled that they can get from the library 15 to 30 books that they can read to their child, who is extremely responsive at 3 months to books, which is wonderful. It warms my heart. So, helping families where they're at, I think, is the best we can do. We haven't been charging any overdue fees during this transition period, simply because our software doesn't know what to do with a 4-day quarantine. And so I'm hoping, and this will actually go to our library board tomorrow evening, to really consider eliminating overdue fees altogether, which I know the Oshkosh Public Library just did that. That is one way we can help those families who are struggling.
Oh, wow.
Use the library because they have an overdue fee. Let's just kind of scrap that, and let's think about what can we get in the hands of the people who need us.
Well, provided they return the books at some point.
Exactly. Yes, you're still responsible for the physical item to be returned to the library. But if you can't get it back on time, we're going to say, well, get it back when you can.
That leads to my final question. I was going to selfishly ask you, I as a new parent myself, as I look back on my own childhood and my sister's, I think the only reason we were decent students is because we read all the time, and our parents were constantly taking us to the library to read books. So what advice would you have for me? How do I get my daughter hooked on reading and to become an avid library customer?
I think reading every day, even to your infant, it's important that your infant hear as many words as possible. Those kids in the lower socioeconomic class where they are not read to are at a word deficit by the time they get to kindergarten. So read every day, and allow time for responses once they can do that. But, we run out of things to say and sing to our infants. I'm trying to remember, what are all the songs that I know? But pick up a good book. And a lot of times if a librarian is there, they're going to recommend some great books, and read to them every single day. And don't feel guilty when you can't read to them, but just make that a part of your everyday routine.
That's great advice. And my wife has the singing taken care of. She's a very talented singer. So the baby's getting a lot of good kind of oral engagement from my wife. My voice, on the other hand, is terrible, and it is actually a source of trauma. But Peg, I want to thank you so much for explaining just really the innovative approach you're taking there in Waupaca to trauma-informed care. And I always tell people who are interested in this issue at the national level, there's something in the water in Waupaca because you're at the leading edge out there. And so thank you so much for what you're doing. And if people want to know more about just the library in general, but some of the trauma-informed care practices in particular, where is there a place they could go, or what's the best place for them to learn more about what you're doing?
A lot of it's not necessarily out there in the world. It does feel like all of these wonderful things are happening, not necessarily in conjunction with each other. I'd encourage them to email me. I can put them in touch with some of our arts community, some of the great workers that we have at the county who are doing such important work with our families. But my email is on the Waupaca area website. If you need more information, please don't hesitate to email me or even pick up the phone and call.
Old fashioned, you can pick up the phone and call, or even better, just go to the library and walk in and have human to human interaction, which
with a mask
is more important now than ever. With a mask, more important now than ever in today's digital age. So, Peg, thank you so much for your leadership, for your compassion, and your dedication to the Waupaca community. I really appreciate it.
Well, thank you, Mike, and thank you for making this trauma-informed care something that people can understand and can adapt to and can adopt for their communities. So I want to thank you for the summit I went to last year. That was great. I learned so much, and I think the more you learn, the better you do.
That's true. So yet another reason to keep reading your whole
Yes.
life. So I need one of those book packets for a 36-year-old too, not just a kid.
Hey, we can do that.
All right. I love it. All right, Peg, thank you so much. Have a
Thanks,
great day.
Mike. You too.
And that's a wrap. Thanks to all our contributors who participated in this special edition of the New Look podcast. And before I leave, I will say that while the healthcare debate too often devolves into partisan bickering, trauma-informed care is an area with overwhelming bipartisan support, and I've introduced a number of bipartisan bills and resolutions promoting and strengthening trauma-informed care, and I think that moving forward, that bipartisan momentum will continue to grow. So thank you again for tuning in.
The dude